My name is Tom Davis, and I live about 12 miles northeast of Brookings here. Been a resident of Brookings County my entire life, pretty much, and I'm a farmer, and I'm raising livestock and crops. I woke up in the first week of October. I had a very burning pain in my lower stomach area on my left-hand side, and so I initially went to the Sanford Clinic where I have been doing my medical care, and the doctor there examined me, and then she said, "I think you have a kidney stone, and we'd like to make an appointment at the Brookings Health System for a CAT scan." Calcium or other food materials that end up in your kidney calcified, and then they can fall out of your kidney and try to get to your bladder, and mine just didn't move, hardly ever. So it felt like almost like a starfish poking in you in every direction, extremely painful. I mean, you would go periods of time when it would there'd be no pain at all, and you think you had passed it, and then all of a sudden it would move, and then just the pain just keel you over. I mean, they sent the results to the doctor at Sanford Clinic, and then she called me and she said, "Tom, you got a kidney stone that's 6 millimeters across." And I said, "Well, is that big?" "Well," she said, "I've seen some bigger, but that is pretty good sized." So then she said, "Would you like to see Dr. Bhat at the Brookings Hospital System about getting it taken care of?" So I said yes, and so she made an appointment for me. He was very thorough in explaining, the kidney scan. He's got that diagram in his office, and showed me the possibility of it passing on its own. He said a lot of them pass on their own. He said, "You don't have any infection or anything, so let's just go. You go back home, and I'll prescribe you some pain medication." And so I did that, and a couple of times I thought it had passed, and I didn't know it passed because I went 2-3 days sometimes without any pain. Well, then I came back to the emergency room because the pain got so bad that I couldn't stand up almost. And then they did another CAT scan and said, "No, it hasn't moved, but it's right where it should fall into the bladder and pass." So he said, "Why don't you go home? We'll try it again for a couple of days." And then it didn't. So then I came back to the emergency room and got an IV, I believe, 3 times to kill the pain so I could at least survive. I knew Dr. Bhat said he did surgeries on Wednesday, so this was a Tuesday night, and they called him and he said, "Yes, I can fit that in tomorrow afternoon." So, it was a sense of relief knowing that I only had to 12 to 14 hours of possibly pain before they took it out. Very, very good. I felt that everybody there, their main concern was to get rid of my pain. They asked a lot of questions to make sure they did the right procedure, what other drugs I was prescribed to, and everything like that. I thought they were very, very complete in that research into that before they treated me. First, they went in and broke the kidney stone up with sonic, is what he told me, I believe. And then he put a stent, a one-way stent, which is still in my body. I think it was so that if there was any infection or anything in the urine, that it couldn't flow back to the kidney. He was very upfront with me. He said, the first day or so of urinating, you're going to have a lot of pain. It's going to hurt really bad. And it did. But since then, I haven't had any pain at all. It's just like it feels like I'm in perfect health since I don't have a kidney stone. Well, I just felt that everybody that I came in contact with felt that I was their most important patient. Well, I would just like to, thank the whole staff here for making me feel comfortable and confident and explaining everything. And I'm glad it's close to home.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.